Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. But it's hard to grow when you aren't attracting the right kind of patients. And today we're going to be doing something very, very special, which I'm excited to share with you guys because we're going to be giving away the essential marketing pack. So I'm going to be sharing a lot of things with you today. And a lot of them you're going to go, man, I don't have those things in my practice. I'm going to give them to you at the end. Okay. So it's a whole workbook that you can work through, and it's going to answer all the questions that you have. I'll be doing that at the end of the show. So I'll tell you exactly how to get that. And what we're going to be talking about is really the foundation of marketing. What is the foundation of marketing? What are the things that most people are missing when they start to market? Now, I'm going to tell you something, and it's going to kind of blow your mind, but most doctors do this exactly backwards. They do it exactly backwards. So I'm going to show you the process, and then I'm going to talk about each step along the way of how people do it backwards. Okay. So we're also on the live stream. If you're watching this live, please comment below. And just to know that I'm doing this right, I'm new to live streaming. So it would really helps me if you just comment or give it a thumb up that you're actually watching this. That would really help me. Okay, so let's talk about the foundations of marketing. Now, again, most people get this backwards. So the first thing that you want to do is you want to nail down your avatar. What is an avatar? That's just your ideal patient. This is the exact person that you want to attract to your office because it's the kind of dentistry that you want to do. Now, the step even before this is you have to identify the kind of dentistry that you want to do, right? So a pediatric avatar, as an example, might be a younger mother who is interested in their children's health. And if you're a Medicaid office, it might be different than if you're a fee-for-service office, right? Different level incomes, things like that. So you want to get really, really detailed in the kind of dentistry you want to do. And then you want to identify the kinds of patients that you want to attract. And you want to document that. So the worksheet that I showed you at the beginning, we're actually going to give that away. It's an exact worksheet that you can go through, and you can just fill in the questions, and it'll actually tell you what kind of patient that you want to attract to your office. This is super important. So what most offices do and what most dentists do is they speak in clinical terms about the kind of patients that they want. So they'll say things like, I want bread and butter dentistry patients. That's great. And I understand what you're saying, but the patients have no idea what you're talking about. I recently listened to a phone call where a dentist took a phone call, and the patient had questions about insurance, and the dentist went on and on and on about how they're a fee-for-service office. Patients have no idea what a fee-for-service office is. No clue. They don't use that kind of vernacular. They don't know what a pro fee is. So you have to first, before you do anything in your marketing, if you want to attract the right kind of patients, you have to figure out who your avatar is. Who are you actually speaking to? You can't do anything else until you figure this out. You always start with this. It's really the base of everything that you want to do. Don't start with clinical jargon or what the dentist wants from their perspective. Start with what the patient is looking for, and you can back into that from what the dentist wants. Okay, hopefully that makes sense to everybody. And so this is the first thing that you want to do. All right, next thing you want to do is you want to build out your brand. You say, well, I already built my brand. Here's the problem. Most of the time when people are putting together their brands, they're putting together a brand that they love. And there's nothing wrong with you loving your brand, but are you the person that you want to attract to your practice? So I'll give you an example. If your ideal avatar is, let's say it's a 35-year-old mom with 2 kids, married, works a job at a medical facility, that's your avatar you want to attract, and you're a 60-year-old male, a dentist, you have different taste and different opinions about what is nice and what looks pretty and what's going to attract you versus them. You are massively different, actually. And so a lot of times what I see dentists where they make this mistake is that they build things that they love, but it may not speak to the avatar. And that's a huge problem. Your marketing won't work, or it won't work as well as it could work. So what you want to do is you want to first start with, what does the avatar want? And then you want to build out your brand from there. And here's the problem. A lot of marketing companies don't push on this kind of stuff because it's easier just to give the doctor what they want. So I'll give you an example. If you go to most marketing companies, you're gonna go to them and say, I want this, I want it to look like this, I want it to look like the Apple website, and I want these kind of pictures, and I want to have like a luxury brand feel. And there's nothing wrong with that. If that's what you want, that's fine. And most marketing companies will give you that. Here's the problem. They won't have a conversation with you that, hey, that might not attract a mom who's looking for value, not for luxury. So you have to think through that, right? You can scare people away with your website and your brand by being too nice, right? They can look at it and go, oh, this is too expensive. I can't bring my whole family here. I have 4 kids. I'm not going to be able to afford to bring my family here. And you might be going, no. You're exactly who we want. Or maybe you do want a luxurious brand and you do want to scare people away that you are, you want to only work with a certain echelon. So that's fine if you're all cosmetics and things like that. Nothing wrong with that. But you got to get clear on what the avatar wants. Okay? This is so important. So important. So first, you build out your avatar. Then you build out your brand. And we have a whole brand sheet that helps you kind of navigate this to figure this out. So you can fill in the questions and it helps you arrive to what your logo should be, fonts, colors, things like that, okay? All right, so next. Now you build your website. And I already know what you're thinking. Gary, I already have a website. It already has a brand on it. It just doesn't, I haven't done the avatar part. That's the problem. You need to figure out who you're attracting, then build out the brand, then build out the website. This is your copy. These are all the different landing pages. And there's ways to do this in a simpler way. I know people hear this and they go, "Oh, great, $50,000 or $20,000 or whatever," right? There's ways to do it cost effectively, but you have to do it in this order. So you start building out the website. You're building out the copies, the copy for the website, the landing pages. You're making sure that it's mobile friendly. You're making sure that you have treatments, landing pages, right? So if you're saying this is where we get into some of the nuances. So you're saying, well, my avatar is a family, but I also want to do implants. That's okay, but you actually have to start this process over again. So first, what you would do is you would say, okay, what's the bulk of your business? Well, the bulk of my business is family dentistry. No problem. So the avatar is gonna be a mom, 35 to 45 years old. She's in this income bracket, this many kids, blah, 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 blah. And then you build the brand to that, and then you build the website to that. But you say, but I also want to do a lot of implants, or I want to do all on 4. Well, that's a separate avatar. So now you start the process over. You don't necessarily have to have a whole brand new website. Sometimes you do, depending on the size of the treatment. But you start it over, and then you build a landing page for that. Why? Because if you have all on 4 on your website and you're like, yeah, I do all on 4, it's $30,000 per arch, and a mom comes and sees that, it's going to scare them away. Or vice versa, if someone's looking for an expert to do $30,000 worth of treatment, they're not looking for a family dental practice, right? It's actually going to repel them. So certain avatars and certain branding can repel certain kinds of patients. So you got to identify this each step of the way. Aligners is another great one, right? So if you say, okay, well, I want aligners, that's great. Who's the avatar? Well, I want teenagers. Great. That has a specific brand, a specific kind of website or landing page. Then you start to build out the marketing and those kind of things, which we'll talk about in a second. But let's say that that's not the avatar that you want to attract. Let's say that you want the working woman avatar, which is different than teens. Well, that's a totally different avatar, a totally different brand, a totally different website. They care about totally different things. And so each of those avatars need a separate approach. So you need to work through that. And that's what the worksheets I'm going to give you at the end. Okay. It's going to work you through this. I know some of this can be overwhelming, but I promise you it's not as intimidating as it sounds. Okay. Okay. So what's next? Now we start to build out the messaging in the video. So again, everybody does this backwards. They're like, let's make this great brand. Let's make these awesome videos. And those are all great. And I'm sure they're awesome. But does it actually speak to the avatar that you want to attract? I work with people all the time that come to us in beautiful websites, beautiful videos, beautiful, all kinds of stuff. But they're like, we don't have enough new patients, or we're not attracting the right kind of new patients. And it's like, well, yeah, have you read your website? You are speaking to a very small group of people that don't do the kind of dentistry that you want to do. If you want to do bread and butter dentistry, guess who needs bread and butter dentistry? The middle class and lower middle class specifically. And upper lower class, they need a lot of dentistry. Guess who doesn't need dentistry? The upper class, right? The top income brackets. They don't need a ton of bread and butter dentistry. You know what they do want? They want veneers and aligners and things like that. So if you're like, well, I want to do bread and butter dentistry, but you're building this luxurious website and these luxurious videos that focus on like more of a spa, then you're going to be stuck in a weird place potentially depending on your market. And then every market's different. If you want to make it really confusing, every single market is different. Okay? So you want to do it in this order every single time. Who is our avatar? What is the brand? What is the website? What is the video and messaging that we need to build around that to attract people for our ads and things like that? And then I'm going to add something here. I'm going to throw a curveball that you won't see coming, okay? Then you need to go out and you need to get specific reviews to that avatar. So let me explain. It's great to get Google reviews. Get all the Google reviews you can, even if there's no comment on it. You know how you can leave like a 5-star review and there's no comment underneath it. That's great. Get all those that you can. However, if someone wants a specific treatment like aligners or like implants or all-in-4, they're going to go through and read all of your, like a lot of your reviews, and you need to have reviews that line up with the service that they're wanting. It's like if you go to a restaurant and you want a specific kind of food, you know, you want a specific kind of enchilada, or you want a wet burrito. I just went to a Mexican restaurant and had an amazing wet burrito from there. It was great. But if I wanted that wet burrito and I go to look at the reviews and there's nothing on Yelp, there's nothing on Google about wet burritos, and it all is just about tacos, I'm probably not going to go to that restaurant. Does that make sense? So you need to get reviews specific to who the avatar is if you're going to want different kinds of treatment. If you're going to want full arch, if you're going to want aligners or whatever it may be, okay? Understanding this process and doing this process every time that you want to walk through a different type of avatar is so crucial. And the reason it's getting more and more crucial, I've been talking about this for a long time, but now it's more crucial than ever, is because more people are doing this and understanding this, and you have more niching out in the dental industry. You have full arch centers. You have people who just do a ton of aligners. You have family dentistry. You have everybody's kind of picking their lane. The more that happens, the more specific you have to get when you want to attract those people, because they'll just pick the other option that's more specific to them. And if you're trying to be jack of all trades and you're just trying to blend it all together, if you're trying to speak to everybody, you're speaking to nobody. Really important to understand that. And again, there's ways to do this simply. You can build landing pages. You don't have to necessarily revamp your whole website, but maybe you build a landing page just to that specific avatar. And then you start working on Google reviews and the brand and all that kind of stuff. So you go in this order though, okay? This is the order you got to go in. You don't work in the opposite order. So hopefully this was helpful for you. If it was, give me a thumbs up. If you want this information, so you say, I want the worksheets. I want the avatar worksheet. I want the brand worksheet. I want those things. Okay, great. Comment down below and we will get that to you. And let me show you what that's going to look like. If you comment down below, wherever you're at, I'll come find you and leave that down below. Let's see if I can get this pulled up here for you. Here we go. So let's just go through what's going to be in this workbook, which, by the way, this cover's sweet, right? Okay. So develop your logo. You're going to be able to figure out what your visual brand identity is, define what makes your practice stand out, and identify your ideal patient type. I think in here too, so we got the logo questionnaire. So this goes through, this is what we do to help dentists nail down what their actual logo is, what they want from their logo. Because a lot of people have it in their head, but they have a hard time verbalizing it. So this worksheet will help you with that, so you can communicate with your graphic designer, your marketing team, or whoever you work with, right? Doesn't have to be us. If you want it to be us, you can reach out. Visual brand identity questionnaire. So what do you visually want to represent yourself as? Create your UVP worksheet. If you don't know what a UVP is, this is your value proposition, your unique value proposition. So what makes you different than everybody else? Ooh, okay, cool. We have somebody that said they want the worksheet there. I saw the comment pop up. That's cool. Okay. New patient avatar worksheet. So this is going to help you identify who the avatar is. So start with this one. Okay. You want to start with this one, the new patient avatar worksheet. This is who you start with. Do that first. Then you want to do your UVP, your unique value proposition. Does it speak to your avatar? Then you're going to go through and do the brand. Then you're going to do the logo. Does that make sense? Okay, so you're going to get all this. It has so much stuff in there. I've already seen people commenting below, but just comment below. We will get this all to you. It has 24 pages, okay, of just goodness, lots of marketing goodness. All right, so hopefully that's a helpful to you. Comment below. Let me know if you want it, and then we'll get it to you. Whether you're on YouTube, Facebook, wherever you're watching, go ahead and drop a comment. We'll get it to you, and we'll go from there. Thanks so much for tuning in. We're going to be here every day. I'm doing the live stream thing. I know the quality is a little iffy, but we're working on that, and we'll get it better and better. Thanks so much for tuning in. Have a great day.